6'8".
I can do
No,
that.
I'll go 7'7".
I can do that.
7'7". Okay.
I need to pick it up, guys. I don't have a good. I can't get the same guess as you.
You can feel it afterwards.
All right, I will.
So this is a mastiff with a distal radial lesion. 3-view chest rads show no evidence of metastatic disease. We did a core needle aspirate this morning and just got the stat result back from the telecytology service. And unfortunately, there were too few cells to make a diagnosis. So the owner is decided to proceed with limb amputation under the presumption that this is a primary bone tumour. So we're just going to do a 4-quarter amputation now. For some of you who've seen my amputations before, I don't do the traditionally described approach of an incision down the spine of the scapula. I can't even really feel this. Oh, there it is. And then circumferentially around the limb, just because I don't like the YL type of closure. So I do an elliptical incision around the limb so we get that closed more on a straight line, so less risk of wound healing complications. I presume this table is up as far as it can go.
Up? No, I can go here.
Yeah.
Still going up.
Oh, you got them on the normal table?
Sorry?
You got them on the normal table. Wow, it's a good effort. That's good there.
It's good there?
I think so, yeah. Not yet. Just getting myself some more room here. I don't know who does these, but they go really tight on the available.
You're on with it. Yeah, it's my fault.
That was you?
Yeah. You're nice about that.
So this dog's 78 kilos, so this is going to take a little bit longer than most cases. Okay, sorry. I'm going to do as much of the lateral work as I can before kind of moving immediately, just to minimise the amount of time that we need to abduct the limb. It's going to be a heavy limb for 2 beefy assistants to hold up. Mateo's been working out. I'm not sure about Piyush, but have you been working out recently?
Thank you for the shout out.
What's that?
So thank you for the shout out.
Let's hold that there. I moved the rower and the dumbbells into the garage as well.
Oh, did you?
Yeah.
Nice.
Thick skin.
I think
Yep.
we'll end up doing that same model that you have.
Yeah, it's a good one.
Yeah.
I work out how to do squats with it now too. It's not as intuitive, but it's still works.
One thing I might do is get like there's a model where like that same model, it's like if you change that it goes up higher.
Yeah.
Because sometimes I feel like the slack kicks in too quickly,
Yeah.
and so maybe the only change I make.
That's
Oh,
okay.
You want
He doesn't like it. He doesn't use the.
No hope left for my lungs. It's your young lungs that have to worry about it. So it's all drifting towards you anyways, that's good. I'm okay.
That's what I'm here for. Take big breaths for you.
I hope Sarah's not watching.
Yeah.
I'll be out of it in a sec, don't worry. Okay, can we get the harmonic scalpel plugged in?
Can we get the harmonic plug in, please? Yeah. Hey, girls, get 2,000.
So I can feel the spine of the scapula just here. So we're just going to take the transversarius and trapezius off the spine of the scapula like we do normally. So the muscle dissection is exactly the same as the technique that's described traditionally. It's just the skin approach is different. That's not usually a very good sign. Okay.
It's not even tight enough in the drawing.
I know, but it's not usually the case. So I've done that. Oh, maybe sorry, I closed the jaws. There we go.
Start at 10.
So this is going to be the long part of the dissection. Lots of muscle to get through, a big dog. I've used a large jawed ligature for this on at least one occasion. I just really wasn't that impressed.
The impact?
Yeah.
Find it tough just to dissect with it? Is that right? Like, they actually get the jaws and separate the tissues?
I didn't think it was quicker. Like, it took longer to get through, and maybe I should just try it again and see if I have the same
It felt
experience.
quick yesterday when we used for the splenectomy.
For the what?
For the splenectomy, you used the impact.
Okay.
And it felt really quick. Nice big chunky bites. Sometimes I'll go running and like people will be barbecuing.
People what?
People will be like barbecuing and that same, it's almost the exact same smell.
Oh, it is. You can either,
I'm like, oh, I'm back in the OR.
yeah. You can either just remind you of a grill or turn you off
Yeah,
meat totally.
it definitely doesn't turn me off.
We have ticks in Australia that aren't typically that bad. They cause paralysis in cats and dogs.
Okay.
But now there's a syndrome that's been found that in humans they can induce a fatal, it's called fatal mammalian meat allergy. So it can cause...
is it the Lone Star tick?
No.
They have one similar, I think, in the States.
Okay.
I didn't know it was fatal. I knew that it caused allergy to red meat, but...
This one's fatal. Well,
Okay.
it's often fatal because people don't know they have it.
Oh,
And
until
they...
yeah. Australia just comes up with the funnest little things, eh?
It's funny, my roommate was just talking about that, like the allergy to red meat, and I thought she was making it up. And I was like, there's no way that's true.
You're lying, yeah.
Lying.
Thought she had it.
No, but she was saying that like that tick that carries that disease in
Yeah.
around here.
I think it's called the Lone Star tick, if I'm not...
Oh, it's around here now as well?
I think so. I think that's what she was saying.
I don't know whether I told you, but I got really into smoking for a while. Like, we've got a smoker up at the cottage.
Okay.
And like doing it all the time. But then it just got like, I smelled the smoke, the cottage smelled of smoke, opening up the fridge smell of smoke. Like, no, it's a bit too much.
Yeah. But yeah, I love smoked meat. It's so good. Do you ever smoke cheese?
Did I?
Just mostly stuck to meat.
It's mostly meat. I did try. What did I try? It's like a spag bog or something. We do salmon in it fairly frequently because it's
really
just an hour. It's pretty quick.
Yeah.
I cheat now with the smoker too because I tend to sous vide it for most of it because you don't have to worry about checking it and basting it and checking the coals and the water and then chuck it in the smoker for two hours or so just to get the... So we're through the trapezius and the omotransversarius. It's coming up dorsally above the scapula. So there's our dorsal scapula, so we're just going to come around there. And now I'll just come down through here.
Oh yeah, thickness about myself.
Yeah. Kind of coming halfway through the muscle in the deeper half. I'm old enough to remember when we did these without cautery, so this is much better than than that.
It's a bit of an experience.
It was a bloody mess. Even with quarter, it was like you prided yourself on how few lap sponges you used. So just coming up through the rhomboideus dorsally. Serratus ventralis. Yeah.
I've been getting it's not an emergency, but just to like fix the camera, give page someone in. Sorry, Mel, could we fix the camera?
Yeah. Did you want it like fast?
Yeah.
No, like on the maybe.
Can we have a like a large bone clamp like the
Like
no, probably the Kearns, something like that.
you want one or two?
Just one. It's getting too heavy for me.
And on the spine?
What's that?
Do you want it on the spine?
No, it's okay. Yeah, so you want to use the Kearns. Oh, sorry, sorry. Now I know what you're talking about.
What do you know?
Whatever you want, whether you want it on the scapula itself or on the spine, whichever's easiest to.
I'm passing you the Kearns, Doctor. I think my hand, honestly, right now is working fine.
Yeah.
Later on, I'll put it. How's the chair? Christine?
That's the one thing with this dog is that all the nerves, and when you're large. It's great, thanks. So I think this is the deep peck. Okay. So let's start working on this serratus frontalis. Just get where your hand is there. So we're just working on the serratus ventralis. So once we get this, most of the cranial dissections done, then we'll work dorsal and caudal.
The heat from that is no joke.
Nope. So Matteo is just commenting the heat that this generates is quite hot. It's a good point because the heat generated by the ligature is around 70 degrees, but this is 200 degrees Celsius. So when you're close to it, it does get a bit warm. So obviously you can't really see what I'm doing here, it's all kind of deep. But the serratus ventralis is the main muscle holding the scapula onto the body wall. I still prefer to use a vessel sealing device to get this off the medial scapula, but a periosteal elevator is another good technique for this as well. Can you hit the button for us? Can you hit the button for us? Hey, can I try the impact ligature?
Yes.
Let's see that. A head-to-head comparison. So I'm just going to, as you may have heard us talking, I'm not a huge fan of the impact ligature, but that's probably unfair because I've only used it once. So we're going to see if it makes much of a difference in this large dog. And I may change my mind.
There's a couple yesterday that were sticky.
Okay.
Yeah, I'm gonna take a round while you
Is this
test
the
it.
new one?
What's that?
I'm gonna stay while you test it just in case.
Okay. So you can just like that. Lock it in and then like that.
Yeah.
And then how do you
And then you squeeze it again. Yeah.
Okay.
Same thing as the handheld one.
Thanks, Alyssa. And then I'm being a bit overly generous. I'm trying to get the. For driving a car for the first time, it's like, like the mental processing of which step next. I think I missed the important step a couple of times there.
I did it one time during the laps earlier, like when Phil came back to his lap. He was letting me do the lap spin and I accidentally cut before I coagulated. Small dog. Small dog.
You have to keep you press the button the whole time too. No, we're good. I'm just learning how to use the instrument like a little kid.
It's working nicely though.
Yeah, so good. I'll potentially change my mind. As you said, it does help if you. I'll just go through there. It does help if you try to seal before you cut.
Is it a good time for a quick question? Marvin, the ICU seconds turned off the jelly for Marvin. She was wondering if that's okay with you.
Yeah.
And she's asking if she can give a Dex bolus.
Okay. Yep.
I think you just leave it all.
Okay.
Thank you.
Should we start? Why don't you start that way? Where's the You go that way, I go this way. So we've got dualing vessel sealing devices right now. I definitely think the impact is beating me. Maybe come in. Trying to turn the corner here, but if you can. That's taking the jewel a little too far. Pretty thick muscle there, but oh, that's impressive. So we're just going through the thoracodorsal now, and it's a pretty thick muscle, and maybe we're being a bit too...
A little too greedy there. I'll split it in half.
Good to try. So I'm just using the Kern bone holding forceps just to get a bit more leverage. Mateo's, we tried to go through the thoracodorsal with a single bite, and it was actually doing pretty good to begin with, but then we missed the blood vessel by the single bites, and now we're just doing the lateral half, then the medial half as we go through the muscle. That felt good. Now there is a blood vessel on here, so we have to be careful of that. Do you want to just grab me a couple of hemostats? Just in case. It's usually bigger, it's usually underneath the muscle, or in the muscle. I'll just keep on going, and then if we don't get it, put the hemostats there just in case. Is doing the old double seal, possibly on purpose.
That was on purpose.
That's all looking good. Keep on going, maybe one more underneath there, yeah. Okay, so
Go on that side.
That's wicked. I think we've still got, there's the auxiliary vessel there. Let's just
Do you want the block or no?
not yet. What we might do is just do the continue under there. Yeah, that's good. So we're just going to do the medial part of this now, and that comes out like so. Okay. this way. Okay, let's grab this one. Let's just go through this way. Look at that, doing it like a pro. No, I wasn't.
Talk to you soon.
Just that little one snapshot. Let's keep that one. Let's just flip it over the other side. Does that. Deep on that one. Sometimes when you go the back side, or the medial side, you get very close to the axillary.
Yeah, I bet, yeah. Are you ever scared that by like severing all the muscle attachments, basically just relying on the nerves and blood vessels, like those are the last things attached, and if you said, oh, okay, I accidentally let go of this arm.
It's a good point. I don't. So, bottom line, don't let go of the arm.
Fair enough.
No pressure.
Yeah.
Okay, so now we're at that stage where just looking for the vessels. Here's our vessels this side. So the
Never seen them from this side.
yeah, the fellow after me, Trey Calfee, his modification to the doing this was going immediately first and getting the vessels initially, and then working after that.
It seems like a nicer working field.
Yeah, certainly you can see them quite
compared
nicely.
Yeah, like lifting the arm.
So,
Oh, thank you.
so can I got the 2.0? Do we have 2.0 PDS there?
Yeah, it's on that new driver.
So here's our axillary vein just here. So I'm just going to dissect around that. No, sorry, our artery. So this is a big dog, so I'm going to put a couple of one of these ligatures just cranially, just to prevent bleeding from when we remove the leg. The scissors there. You can just grab me those ones there. No, thanks. Another one distally. Yeah. And then just to make sure that we don't get a slippage, instead of doing a circumferential, I'm going to do a transfixion. So I'm just going to come through the middle of the artery like this. And I always do this last, so the only bleeding I get once I go through the artery is blood that's in between that ligature and that ligature. So we don't get excessive bleeding from the transfixion itself. One of the ears is just caught in there, so I'm just going to grab that out. Okay, not as though it's going to make too much difference, but I'm going to transect between the transfixion and the upper ligature with the harmonic scalpel. No bleeding. And here's our vein down here. So what I might do, we've got the big nerve, the bigger nerves down here now. So I'm just going to inject those with ropivacaine. See if I can come from this direction. Not really. That's the bigger nerve. Let's see if there's any other ones in here. Well, that's just kind of settling in. I'm just going to come through laterally here to see whether I can see any other nerves worthy of some local anaesthesia. So I like to give that about a minute or so to instill. So we've got one decent nerve there. Okay, I'm just going to go through this nerve at least. Hopefully, if we've done the right job, it's not going to jump. We've got a little bit of fasciculations going on there. Do this one as well. That's going to give us a bit of a better view of our axillary vein. Okay. Let's see if we can lift it. Yeah, that might be better. That's good, thanks. I'm just working my way around it just to free all that up. Okay. So with the vein, I don't usually do a transfixion ligature. Let's do 2 circumferentials. Thanks. Thanks. The one close to the limb, you don't necessarily need to do a ligature, you can just use a hemostat.
I took this twice. Was there a you could see? Yeah.
Okay, so that's the axillary vein alligated. We'll just bring that up again. Okay, so let's just see what's hanging on now. Okay, so we don't want to go through artery and vein again. Let's see where I go So what I'm just going to do very quickly here is grab our lymph node here. Dogs with lymph node, axillary lymph node involvement or metastasis have a significantly worse survival time than dogs that have a non-metastatic node.
Did you see that though, or just because the blood vessel that was running by it?
No, I saw it there, but it just came up as we're dissecting it. So we'll submit this one separately. So 2 axillary nodes for the day. Okay, so that's our axillary lymph node. Okay. Almost there.
Not bad. Pretty good. I think warm up. I think a lot of the weight was resting on the dog. As soon as I lifted it up. Oh, you know what? It's not bad.
So we're just trying to refocus. Legs out. We're just trying to guesstimate weight. I might go down to 5.
5?
Maybe.
Oh, you're right.
Okay, so that's the focus.
What, 3.9?
What? Not right now.
Just curious.
We got 0. So we're just going to close now. We're going to close the thoracodorsal to the transversarius and the trapezius and the omotransversarius, then the cutaneous trunci. So just use 0 for that. And then 2.0 for the cutaneous trunci, 3.0 for the subacute, and then see how that looks. If you want to put in skins, you can put in staples or continuous. Thank you, everyone.
Thank you.
I'm going to take. Actually, I might take both.
Oh, Julius.
Yes.
Are you okay with this dog getting a urinary catheter?
Yeah. Yeah. I am. Yep. Is it? I didn't. What's the? Okay. Let me have a look and I'll let you know. Do you have a formalin jar there?
I don't.
Okay.
I don't have a label either.
I'll come back and grab the lymph node and I'll go and weigh the leg now.